is the tympanic membrane. So if I have an infection right here in the middle ear, all this is very difficult to be removed. You have pus there, you probably have blood there, you probably have some secretions, it's a bad ear infection. Well, you're not going to be able to hear from there. You have pain, you have an infection. Well, you go to the doctor and they cut right here. They cut right here, make two little holes, and then put two little straws that sticks out. I don't know if you have seen someone with two little kind of straws coming out, very fine tubes. So all these secretions from here are gonna be drained out your ear. So we do these little incisions, not a hole. It's a little incision, and you push those little tubes inside to drain. So maryngotomy is the process of making the incision. So we can put the little tubes, or we can drain. If it is liquid and it is not much, we can drain it from there. So these are procedures that are done in a doctor's office, but has to be a specialist, of course. This is not just your regular doctor. This is not, has to be a the specialist of the ear. So it might be an audiologist or a plastic surgeon that it deals with the ear. So otitis. Itis is the suffix, means inflammation, you know that. Ot is the word root for ear. So this is inflammation of the ear. It can be the external canal. You have an infection here because something went inside your Q-tip and scrubbing inside, going up and down, so you damage the lining of the ear inside with these Q-tips because you don't know how to use it. Some people don't use Q-tips, they use anything. They use a pen, a pencil, I don't know how you call these, needles, a little stick, a toothpick. Oh my goodness, I've seen so many things. They put just anything, a paper clip. So then they scrape right here. This is like scraping the inner layer of this canal. Well, what's going to happen? It's going to irritate, it's going to swallow, you're going to get an infection there. Or you can get an infection of the middle ear, right here. Inside. You don't get infections to the inner ear. You don't get infections here. You get infections middle or external. So you call it otitis externa or otitis media. There's no otitis interna because this right here, everything has to do with the nervous system. So we don't have that here. We don't have infections of the inner ear. We have infections of the middle and the external ear. Okay. So we can see there's one that's calling the swimmer's ear. That's otitis externa. We call it the swimmer's ear because the person went to swim, whether in a pool, in a river, in a lake, in the ocean, who knows? Wherever the patient or the person went to swim, and water gets stuck right there in the ear because you have a lot of wax. So the wax doesn't allow the water to come out. So then you start jumping, trying to get the water out, and because it doesn't work, and because you barely hear from that ear, you start putting things inside. So then you cause an infection of the ear. That's called the swimmer's ear. That happens a lot. Seen many of those patients in the office in emergency. Okay, moving on. Oroplasty. Now, this is the surgical repair of the ear, not just the membrane, not the eardrum, it's the ear, any part of the ear. It can be this external area that is called the pinna. Sometimes people look like, so then you ask them to fix it. Well, you pay for them to be fixed. So that's cosmetic. And the word root, which is ear OT. Plastic, remember, this is a surgical repair of the ear. If you have damage to the ear, trauma to the ear, ears that don't look nice or something else, then you get oroplasty. So these procedures actually exist. Some of them is just made up because of the medical terms. Here we have otorhinolaryngologist. So this is one term. Logis, O, suffix, combining vowel. Laryng is a word root. O is a combining vowel. Rhyme is a word root. O is a combining vowel. OT is a word root. These are the ears, the nose, the larynx. So this is the specialist, the medical specialist who treats the larynx, the nose, the ears. That's what it's called an otorhinolaryngologist. We say it very easy. ENT. That's it. Ears, nose, and throat. So that's how we call it. So instead of saying larynx, we used to throw the pharynx. The ENT doctor. You heard about that. Sometimes we are referred to it. Oh, you're going to see the ENT doctor. Why? Because, oh my goodness, if I tell you you're going to see the otorhinolaryngologist, you're going to drop, not dead, but you're going to drop like kind of unconscious for a little bit. Because you think that something really bad is happening to you with this name. I would think the same if I wasn't familiar. They said, oh, you have to go see the otorhinolaryngologist. I said, oh, wait a minute. Do I have time still to sign my will? I don't know. Anyways, so that's why we use simple terms, ENT. Oh, you're going to see the doctor or the ears, the nose, and the throat. That's it. Here is another term that is very similar, but in this case, specialty. Oh, that's totally different term. And a specialist is someone who specializes in something. And a specialty is a department, is a science. Zoology is the suffix. O is a combining vowel. See, Larry is a word root. O is a combining vowel. Rhyme is the word root. O is a combining vowel. OT is a word root. So this is the science that studies the larynx, the nose, and the ears. So that's basically what it is. Be careful, it's ENT, not EMT. This is the emergency medical technician. That's a different issue. Don't mix them up. Here we're going to use the same word root, but we're going to use a different suffix. Ria, that's the suffix. O is a combining vowel. OT is the word root. So RIA means discharge. So this is a discharge from where? From the ear. So if we have otitis externa, which is infection to the external canal, then we're gonna have some secretions coming out from there. That is called otorrhea. Again, these are fairly common infections of the ear that produces these secretions. So patients are going to come over complaining about that. Otoscope, we know already what's an otoscope. Scope is the suffix. O is the combining vowel. OT is the word root. Scope is the instrument. This is the instrument that we use to visualize, to see, to view, to examine inside the ear. Remember, just the ear canal. We don't go and see anything else deeper. We see everything, including the tympanic membrane and the little bones that are in the middle ear. So again, it's just to look at the external canal, not go any further. Okay. Tympanic, IC is the suffix. Tympan is the word root, which means the eardrum, pertaining to the eardrum. You cannot say the eardrum pertaining to, doesn't work that way, right? So it's pertaining to the eardrum. There is something with the eardrum that we're referring to. That's basically what it is. Tympanoplasty. We covered this already, but we said maryngoplastic. Remember, this is the same. Maryngo, tympanoplastic, maryngoplastic means the same. It's the eardrum. We're talking about the same structure. Plasty, and this is the suffix, surgical repair. This is the combined vowel. And tympan is the word root, which means eardrum. This is the surgical repair of the tympanic membrane. Sometimes trauma can cause the tympanic membrane to break. So we have to fix it, because that is something that prevents anything from the outside, from the external canal to go to the internal, the middle canal. So we have to protect that. This is like the doors to go from one room to the other. So that's basically what it is. Let's talk about some of the medical procedures, medical conditions, maybe instruments here. Let me see. No, we don't have instruments right here. Use in this particular field, whether conditions of the eyes or conditions of the ears. Let's talk about the first one, astigmatism. So, astigmatism, we do not divide these medical terms, because remember, these are medical terms not built with board parts. That's basically what it is. Some of them is just cannot be broken down because there's no suffixes, there's no prefixes. So it is just one word, just a medical term. Breakdown. Okay. So astigmatism is nothing else than problems with the curvature. Oh my goodness. almost forgot that see, this time my computer gave me a little window that the battery was off. Sometimes it just shut it down. And I always been thinking, okay, I'm gonna remember that I have to plug my computer after kind of 2 hours or something like that. And then I forget because I get caught up doing all these words and I'm not worried about time. So I'm not checking anything else. I'm just concentrating. I'm focusing on whatever I'm doing. So let's back to astigmatism. It's just that the curvature of the lenses, because we have a little lens, a natural lens inside, it kind of changes its shape. So if that changes the shape, the refraction of the light as it passes through the pupil is different. So we're not going to be able to be seen clearly. So that's the problem with the astigmatism. Most of the time when that happens, the person start blinking. They blink a lot. They kind of going like this, blinking. Looks like those little dolls that have fake, the fake lashes, and start moving like very fast. That is one indication that you have astigmatism, because you try to see, to focus on something, and it's not doing it. So then you move your eyelashes. That's what I meant, not eyelids. Your eyelashes, start moving it very frequently, like blinking continuously. So that's called astigmatism. That's a refractory condition. So don't worry about the refractory, just knowing that this is the changes of the lenses. So they are supposed to be in certain shape, and they change the shape, and now cannot get this light in the same direction that a normal person will get it. So you're not going to see the images correctly. They're going to be kind of blurred. That's basically what it is. That's called astigmatism. It can be corrected with glasses or a laser procedure. All depends on what is the magnitude of the damage. Cataracts. Cataracts are very common, particularly on people after 40. Some others starts before. Now, pay attention to this. If somebody is wearing glasses, no, they can have something else. Cataracts are common in elderly people because the eyes already are worn out, the tissues. So you're gonna see like a white patch where you see the iris. It looks like a little whitish. So those are my bad. It's not the iris, is the lenses. The lenses, oh my goodness, what I did here. Okay, the lenses are this way inside the eye. So this is the eye, and the lenses are here. So light passes through this. So this lens becomes very opaque. So the light cannot pass through. This is like putting a curtain in there. But these curtains that kind of transparent, that you see something, but actually, like when you drive in a car, right? And it's raining and gets a little kind of fog in your windshield. That is exactly what cataracts looks like. So what is it that we have to do? Because we don't have a windshield to go there and clean the grass. So they have to do a surgical procedure, which is a laser. With the laser, they kind of scrape, clean up all these stuff that is making these lenses foggy, and that's it. You can see now. So that's cataracts. Then we have detached retina. Well, detached retina now is the most complicated issue. Remember that the retina is the inner layer of the eye. So this is the eye, I'm not a good one drawing, so don't laugh at my pictures. So this is the eye, but if we look at the eye, this is the front. If you look at the eye like this, it looks like this. So it has three layers. This and the inner one. So this inner one is attached to this one, to the middle one. It's attached. So when it detach means it goes loose from this wall. So can you imagine this retina detaches? Well, you're not gonna be able to see anything because it's like this little membrane that is inside. Now it goes close, so no light can pass through this. Now it closes because it detaches, it falls. It's like a curtain that falls down. So then it's not gonna cover anything. So no light passes through. That is due to age or to trauma. You have an accident, motor vehicle accident, or any type of trauma. Somebody hit you in the back with the bat, or you fell in your head, or something like that. Well, that can detach these membranes that are attached to it. That is detached. That was called detached retina. Glaucoma. Probably you heard about glaucoma. I know you heard about cataracts. I know you heard about glaucoma. So here we don't use oma and glauc like, oh, it's a tumor. And no, it's not. Glaucoma is increased pressure on the anterior part of the eye. So let me go to the eye again and see something right here. Okay, so right here. So I'm gonna use red color, no, yellow color. So glaucoma, this part of the eye, this is liquid. This is liquid. We have liquid here and we have liquid on the bottom. And these two spaces are separated by the lens. So this liquid right here is produced by some little tubes that comes from here. See? Here there is some little tubes, here some little tubes, and maintain this liquid a certain volume. This liquid has to be there because that's how the light goes through here all the way to the retina. See, this inner layer is the retina. This inner layer is the retina. So what happened to this liquid? This liquid somehow accumulates because there are too much liquid. It's not draining the liquid. It's not kind of removing extra fluid. So this liquid accumulates and accumulates and accumulates. Oh, wait a minute. Where is that liquid gonna go? It's creating pressure on the eye. Creates pressure right here on this part of the eye, causes a lot of pain to the eye, and it causes your eye to be blurred. You're not gonna be able to see. And what happens if you don't treat this immediately? Your eye bursts open. That's it. You're done with that eye. You lose your vision forever. That is glaucoma. So that is an increase of continuously and another glands are producing the liquid and keeping this liquid there. But when these little tubes kind of block and doesn't allow this liquid to drain, then the pressure inside the eye and the in the anterior part of the eye start increasing, and you start feeling pain, like you're not seeing pain. Next thing you know, you're gonna end up in emergency. So again, that's called glaucoma. Let's move on for the other one. Hyperopia. So here terms opia means eyes. Hyper means increase. So this will be the prefix. Op, see? Opia, you can say the whole thing as an adjective, or you can divide IA and OP. Remember, opt as an optic, eye. This is a word root right here if we divide it, and this is the suffix, a condition. This is a condition of the eye that you cannot see far distance. This is farsightedness. So this is a person that cannot see something that is far away. So if you're driving and you don't see the car that is moving on the light, right, like 20 meters in front of you, then you have a problem with hyperopia, which is farsightedness. You cannot see objects that are far away. So let's say that you're in the classroom and you sit on the back of the classroom and you cannot see, or you have problems seeing the letters on the board or the PowerPoint presentation, then you have hyperopia. That's hyperopia. Now, the opposite is also true. Let's move to myopia, because you heard about myopia. I know for a fact. We hear about myopia. When you see someone with glasses, immediately we assume, oh, they have myopia. No, it can be hyperopia. It can be astigmatism. Okay. So once again, there are many reasons why we wear glasses. But myopia is something that you were born with. This is a defect that you have in your lenses. This is a defect that you have in your lenses, that you cannot see far away, you cannot see something that is close by. See, the person who cannot read these small letters, like I was looking now, I use my glasses to see this chat that you guys send me, this text that you guys send me. That's not myopia, because I didn't have problems with my eyes when I was born. If you see young people with glasses, they have either myopia or hyperopia. Now, the one that I have is because I'm older than 40. I didn't have no problems before. And is this just tiny letters right there? Well, I have something that is called presbyopia. So that is a different thing. That is due to age. That's an age-related vision loss. That's a totally different issue. So presbyopia, myopia, hyperopia, 2-3 different terms. That's problems with the eyes. Okay, is somebody asking me something or somebody running away from me? What is it? Nothing. Okay.
No, I accepted it. Someone wanted to.
Oh, okay,
Yeah.
thank you. Yeah, see, because I was like, I know that there is always a beep, someone comes in. Sometimes it shows right here, admit the student. Sometimes I don't see it, because I'm having two screens right here. I have the big PowerPoint presentation to do all this work, because I have to write it and teach you guys. Thank you. Okay, so that's basically what it is. So hyperopia is a problem that you cannot see far away. Remember, hyper. Myopia, you cannot see something that is close by. But this is for people who were born with conditions. This is not for the people who has to wear glasses after a certain age. That is called presbyopia. It's a different medical term. Okay, I thought that I have it here. I don't see it. It should be. Okay, let's go back to this one, macular degeneration. Macular degeneration, this is a condition that happens to elderly people. They lose their vision not because they cannot see far away, close by. No, they have a condition where there is a structure within the retina all the way in the back of the eye, which has some receptors for images, receptors for color. So let's go back to the same picture again. So I want you to understand it. Right here in this area, on the back of the retina, there is something that is called the macula. The macula. Here is when we have all these receptors of color in black and white. So when you see an image and it is light, you see everything, you see the colors. So I see, oh, this is a red dress, a blue jeans, this has this hat, this color, this bag, these shoes. Oh, this is the color of this person. But at night, we don't see colors. At night, we see black and white. So here we have some receptors that make us to distinguish black and white and colors. So this macular degeneration, as the word implies, this macula right here degenerates, it damages. If it damages, well, the receptors of color and black and white, they are damaged, they disappear. So I'm not gonna be able to see. That's called macular degeneration. That's why as we age, well, lots of stuff happens to us. It doesn't mean that every single person is gonna go blind, not necessarily, but we lose some vision. That's macular degeneration. Okay, let's move on. Optometrist, remember this is the specialist. Optometrist, this is the specialist. Okay. Metry, right here. So tris, met, remember these are opt is vision or eyes. This is a word root. Metry is measurement. Tris, that would be the specialist. So optometrist, this is the specialist of the eyes. But remember, the measurement, met, says right here in the middle. The one that measures the size of the lenses. This is the one who decides which type of lenses you're gonna get, depends on the condition that you have. So that's different. It's not the medical doctor that fixes the eye. No, that's the one that fixes your eyes, but with something external, glasses. This is the one that examines your eyes to detect, to determine which lens describe. So that's basically, these are the doctors that put you to read all these letters with some scopes that they put in your eyes. Sometimes they put some drops in your eyes. It can be an ophthalmologist, but these guys, when they're going to prescribe the glasses, they check your eyes as well. But they do not determine what condition you have, because the medical doctor has already given you a prescription to get glasses. They just do that to confirm, to make sure that they give you the level of the glasses that you need. Okay, we have here otitis media. Remember, we have otitis externa and otitis media. So we're not gonna divide this. This is an infection or infection or inflammation of the middle ear. But this infection is due to this inflammation is due to an infection. So usually, as a medical providers, we don't say, oh, inflammation to the middle ear. No, this is an infection to the middle ear. Because inflammation is caused by an infection. That's the way we say it. No one is going to say, oh, you have inflammation of the middle ear. It says, no, you have an infection of the middle ear. I'm going to treat you for an infection of the middle ear or the ear. Just that's it. Or the external ear, otitis externa. Tinnitus or tinnitus. Remember, you can pronounce it either way because you can use the American way of the British way. Tinnitus or tinnitus. If you hear it differently, it's not that they are mispronouncing it. These are medical terms, so we can use it, we can pronounce them either way. Some of the terms has to be pronounced exactly the same, but for us, tinnitus or tinnitus is okay. This is the ringing of the ear. You have here sometimes like a little ringing in your ear. That's called tinnitus. That's it. So if you have a question when they said, oh, this is a condition where you have a ringing of the ear, what is it? You're gonna look for tinnitus. Got it? Simple. You can say tinnitus or tinnitus. Remember, all depends on, who you're talking to. But both pronunciations are correct. All right. So we went over all these conditions already. Doing good. Let's talk about these acronyms. This is the first one. AST, astigmatism. ENT, remember. We said, oh, what was that? The ears, the nose, and the throat. This is the otorhinolaryngologist. This is the specialty. We're going to the ENT doctor or the ENT office, it doesn't matter, but this is otorhinolaryngologist. OM, otitis media. Otitis externa. OE. This is ophtha. Oft for often, ophthalmologist, eye. So we say it like that. So usually we said we go to the eye doctor, to the ear doctor. So that's basically what it is. Not too many terms right here, but just get familiar with, particularly with ENT, OM, maybe ophtha. Okay, so let's do the pre-test and see what time is it. Oh my goodness, we're doing so well. Okay, question number 1, inflammation of the eyelid. Remember, inflammation, eyelid. That's what the things that we're going to look for. A, B, and C. Okay. So remember, use the process of elimination. There are 2 parts only on this medical term. You can now have 3 parts, 4 parts, it's just 2. Okay, so moving on. Oh, what am I doing here? So let's start breaking down this. Iris, iris, iris. Oh, all of them have inflammation. That's a little. We have to focus on the word root. Eyelid. Red. That's the retina. It's not the eyelid. Myrin. This is the eardrum. It's not the eyelid. Even though if I don't know it, if I have to use the process of elimination, I know that blephar, it will be the correct answer. So letter A is the correct answer. Blepharitis. Blepharitis. What is my tongue is now kind of saying something else. It's blepharitis. Blepharitis. That is the correct answer. Inflammation of the eyelids. Number 2, surgical repair of the middle ear. Now pay attention what it says right here because I went over the graphic middle ear. Let's see. Surgical repair. So right there you have the key. Surgical repair, middle ear. Let's see. A, B, or C. Let's give it a try, people. Even though if you don't know the answer, just try. See whether you got it right or not, so you can learn it. Remember, when we don't try, chances are that you're not gonna remember it later. Okay, so here we're gonna use middle ear. Well, wait a minute, middle ear is right here. Oh. Tympan is middle ear because Otto is ear, so this is not. So don't get kind of. Oh, we're gonna start with plasty and plasty. I see. Oh no, this is not the one. This is plastic, but this is Otto. Oh, that's not the one. So I'm left with tympanoplasty. Remember, they said middle ear, but that shouldn't be written this way. It should be surgical repair of the eardrum. So then you will pick tympanoplasty. But they said middle ear, which is wrong stated. I didn't make these questions. The book did it. Not the book, the publisher, whoever wrote this book. But usually it's not the middle ear because the middle ear is one compartment of the ear. So we're not repairing that part. We're repairing the tympanic membrane.
So in an exam it will appear as eardrum, correct?
Correct.
Okay.
Yes. Or they're gonna ask you the term, the combining for tympano means or refers to what? Eardrum. So that is how it's written. Yeah, middle ear, no. But there is nothing else here, right? Let's assume that was correct. Here is surgical repair of the ear. Well, the only one surgical repair that I have left is tympanoplasty. So tympanoplasty is correct. Is the middle ear that usually don't go with. But because we know that the middle ear is separated from the external ear by the tympanic membrane, they use it as such. But it is incorrect. Literally speaking, shouldn't be used. I go and use it, not like that. Number 3, a specialist who studies and treats diseases of the ear, nose, and throat. Well, it can be easier than this. We say this many times. So it's a long question. A, B, or C. even though if the question looks like very long, but it's easy to answer because you have to go by that. If I see a very long question, it has many parts, well, I'm gonna look for an answer that has a lot of parts there, not the shortest one. Okay, so it says the specialist. So immediately I'm gonna look for this right here on my answers. So my answers have specialists right here. Oops. Logis. I have logis. Oops, right here. Oh, it's the upper one. And logi right here. So logi doesn't apply. Here it says audiology is too short because this says specialist who studies and treats diseases of the ear, the nose, and the throat. Here's the ear, nose, and throat. So just looking at the parts, how many parts are there, then you can get the right answer. Remember, this is logic, but they asked me the specialist. They're not saying the study, the signs, the studies, the ear, nose, and throat. No, it's the specialist. So for that reason, answer C is not the correct one. Remember, sometimes we kind of slip by and don't pay attention, don't focus. Next, the effective curvature of the refractive surfaces of the eye. I mentioned that A, B, or C. It's a little difficult because it says defective curvature, but I mentioned that. And I mentioned refractive. Okay. Let me give you one extra minute, see if you can get it. I mean, you can send me the answer. Okay, so curvature, refractive, eye. Here it should be a little different, but hey, it's the only one. It says right here, opia. Opia. Said myopia. This is nearsightedness. So this is the person who cannot see close by. There is nothing in the question that is telling me that. Hyperopia. There is nothing on the question that is telling me that the patient has problems seeing far away. Well, even though if I don't understand what it is, the next one, I'm going to understand that letter A, answer A is the correct answer, which is astigmatism. Because this is a defect, not of the eye. See, there are things there that somehow shouldn't be. The lens that changes, it is curvature. So then you have this refractive reflection. Refractive is how the light enters and hits the lenses, and now that light is kind of directed to the retina, to the macula on the back of the eye. So it's not entering in the right direction. It's supposed to enter, let's say, perpendicular, but it goes on the side. Wait a minute. The macula is kind of the back directly, the same line as the pupil. So if I'm not seeing the light going into these receptors that captures the image, I'm not going to see the image correctly. The image is going to be kind of twisted, maybe blurred. That's what it is. So it was a little difficult, but once again, if you learn the process of elimination, and if you know myopia, hyperopia, presbyopia, well, it will be different. Next, measurement of vision. Measurement of vision. We actually measuring your vision. Measurement and vision. A, B, or C. Okay, this is the last question. So try to answer it. I know some of you might say, I know what you're thinking. It says, oh, professor, you're going too fast. You didn't even give me a chance to review it, to think about it, to check. Because you're going back to those notes, trying to find it, and then, listen, I was in students before. I know how students do. But that's the purpose, right? But sometimes we got to try ourselves to see. Remember, this is just a kind of pre-test. This is not a real test. So we throw in there to see how much we learn, because we just went over most of these terms not long ago. So we try ourselves. We gave ourselves a little push right there to see how much we learn. Okay, so let it has here meter, meter, metric. What is meter? Meter is an instrument. See, meter is an instrument. They're not asking you about which is the instrument used to measure vision. They're not asking that. So think about that. Don't get kind of tangled in this wording, because sometimes that's what's happening. Oh, are they asking me this and you second guess yourself? No. If it says instrument, oh, now it's meter, but it's not asking about that. So these two, not the right answer. So even though if you didn't know the next one or the last one of your option, you got it right, because you know already that the other ones do not qualify. Metric is measurement. This is the actually viewing. This is like copy, remember. So we use one of these optometers to see, not audio, because audio is for hearing sounds. So optometry. So we know already that we are measuring. We are actually doing the glasses. We are measuring that. We are working on it. Okay. Any questions? Congratulations for all those who got it right, because mostly you got it right. So it's not that I'm seeing your answers, but I know most of you got it right. If you didn't get it right, no worries. You're gonna learn, because this is what we're doing here, learning. You don't have to know it all. You don't have to get every single question right. Not even in a real exam. You don't have to. You just have to pass. That's all. Because you don't want to repeat the class. You don't want to repeat the exam. That's basically what it is. Okay, so we're done for today. Right on time. See, it's like we know how we're going to work all this together. So we have Monday. We're going to continue with these last two chapters that I sent you lately, last night, because there was two chapters that I don't know how I left them off. And we're going to finish them off early. And then we're gonna finish tomorrow. And Tuesday, we're gonna start something else. So thank you so much for not only attending the class, for participating in the class. I know you're gonna say, "Ah, professor, but you're sending us a test." Yeah, but you're gonna have like 5 days, I believe. Okay, Friday, Saturday, Sunday, Monday, Tuesday. Oh, I'm correct. You see, I still know how to add. So you're gonna have 5 days to do the test. So do it. You know, when you have your little time off, do 10 questions, then do another 10 questions or 15 questions and complete it. And then you send it back to me. All right. So I will be sending it to you as soon as the class finish, which is like in maybe 5, 10 minutes. All right, guys. Thank you so much once again. Enjoy your weekend. Don't drink and drive because I want to have my students back next week, not arrested, not something else. So behave, and we'll be seeing each other on Monday again. Take care, guys. Good night.
Good night.
Bye. Good night.